Let's talk about side effects. That's another issue that people have. What kind of side effects are there to this vaccine, and especially what are some of the long-term effects, and can we even know what the long-term effects are at the moment?
Well, the immediate effects within the first 24 hours are usually with the first vaccine of the two mRNA vaccines that we're mainly talking about today, the Pfizer and the Moderna, are soreness at the site of the injection, and then over the next maybe 1 to 2 days, development of more body reaction symptoms, including achiness, sense of fatigue, maybe fever, and just general malaise or feeling bad. For the most part, fevers, when they do occur, resolve within about 24 to 48 hours after injection. Rarely, there have been people that are more prone to develop allergic reactions or anaphylaxis, which is a severe airway allergy type of reaction. Those have occurred at a rate of about between 2 and 15 out of a million. So it's a very low frequency of more severe allergic reaction. Nobody has died from anaphylaxis with this. Most of them have not even been hospitalized. Most of them have been taken care of by Benadryl and epinephrine. So that number for true allergy is very low. And for the most part, as we were talking about the other symptoms, they're fairly well tolerated. I might defer to Glenn to see if he's read anything about any longer term side effects from the vaccines. I don't think we know of any severe or long term side effects from the vaccines at this point. But
No, and I think it's when you look at the vaccine and you look at the ingredients, and I've read the ingredients list on all the vaccines. The Johnson & Johnson vaccine, which is a single dose vaccine, is really very similar to vaccines a lot of us have had in the past. It's a vector vaccine. The ingredients are the same, other than the fact that the inactivated virus in the Johnson & Johnson vaccine, the vector, is carrying a new protein in our body for our immune system to react to. That's the spike protein from COVID. So the vaccine is very similar otherwise to vaccines a lot of us have had in the past, in terms of ingredients, in terms of stability, in terms of safety. So we really shouldn't expect any long-term vaccines, even though we've only been giving this one for now about 3 to 4 months. And likewise with the Moderna and the Pfizer vaccines, the ingredient list is very pure. It's sodium, potassium chemicals that are used as preservatives to keep the vaccine stable in our body and to keep it stable before it's delivered to the body. These are, from a biochemistry standpoint, and I was a biochemist doing protein chemistry research before I was a doctor for 3 years in a lab in New York City. And to me, these chemicals are things that we have in the body anyways.
Glenn, what about ethylene glycol? Or
it's polyethylene glycol.
Okay,
polyethylene glycol is the principal ingredient in Miralax, which is a safe drug on the market that we prescribe for people with constipation and to help your bowels. So PEG, polyethylene glycol, is really the only ingredient that is recommended that with the Moderna and the Pfizer vaccine, anyone who has had any type of allergic reaction or abnormal reaction to polyethylene glycol shouldn't take that vaccine. But that would be very, very rare.